Hi, I'm Claire and I am a midwife. Today I am answering all the questions that you never thought to ask your midwife from the Mumsnet forums. You have come up trumps with some brilliant questions, some weirder questions, and everything in between. I will try to answer as many as I can, but apologies if I didn't get round to yours. Let's get started. So one question is it true that several pregnancies close together increase the risk of premature birth? Not that I've heard of. Obviously, from a mum's point of view, having that many children very close is going to leave you with very sleepless nights, but there's no known risk with that causing premature labour in the future. You also asked whether having a caesarean section at 36 weeks would have any other complications. Who knows, ultimately. Most babies, if they're healthy, will have to spend a day or two in hospital, having their blood sugars checked possibly, and having their temperatures checked. If things are wrong, which we can't always forecast, then maybe it would be that they have to have a stay in the special care baby unit or in what we call transitional care. However, when you have your baby, the doctors and the midwives will be able to advise you as to what the best plan is. The next question says that the lady is undecided as to whether to use a birthing centre or a delivery suite, and what are the pros and cons of each. That is a really good question, and it is very dependent on what you're hoping your birth will be. Ultimately, if you want to go to a birthing centre, you will be restricted on your pain relief options up to about gas and air. So you could possibly have water birth, TENS machine, massage. However, if you're thinking of something more medicalised, you would need to go to a delivery suite. It is a very different experience between having a birth in a delivery suite and a birthing centre. So it would probably be worth it you have a little look around both and decide which suits you best. So should I consider a private Group B strep test at 35 weeks? This is a bit of a hotly debated issue. Some NHS trusts will do it if you ask them, and other NHS trusts will only do it if there's a medical need. I'm not sure how much a private one costs, but if it is not too bad and you can afford it and it will make you feel better, then that may be good for you. However, I'm not saying that that's necessarily the best plan because you may not have any need for it in the first place. Okay, the next lady wants to know what infections she needs to be aware of when working in a nursery with children, such as chickenpox, hand, foot and mouth, and how that would affect her pregnancy. This is a really good question. So if you are pregnant, you work in an environment where you may be exposed to chickenpox, you need to be sure that you're kept away from those children. Chickenpox in pregnancy can be really dangerous to an unborn child. So if you feel that you've been exposed to chickenpox or your child has chickenpox, go to the doctors because they may need to do some blood tests to see if it's come through to you during your pregnancy. Most of us are completely immune if we've had it ourselves, so this blood test would just show that it has made no effect. However, it's better to be safe than sorry. With regards to hand, foot and mouth, I haven't got any knowledge that that would cause issue with pregnant women, so you feel free if the kids have that you can go to work and work with them. So also worth mentioning that if you are a cat owner, make sure that you're not shoveling the poo whilst you're pregnant. Make sure that someone else is doing the cat litter tray for you. You don't want to get toxoplasmosis, which is what's in the poo of some cats, because that can make you really poorly whilst you're pregnant as well. Okay, so the next lady asks if she had some treatment to her cervix for abnormal cells following a smear test, I imagine, and would that automatically put her on a high-risk pregnancy pathway? So yes, possibly. It depends quite how much cervix they removed when you had your treatment, but I would say that we would refer you to the hospital in pregnancy to speak to one of the obstetricians so that they can be sure that you're okay and you're well, because obviously when you've not got as much cervix as the next person, you need to make sure that everything's managed properly for you. This doesn't mean that you're not going to have a water birth or have a really uncomplicated natural birth. However, you would need that extra bit of monitoring in the earlier weeks to make sure that things weren't happening too early for you. So the next lady wants to know about having deep heat cream and things like that for back pain in pregnancy. I would probably stick to warm hot water bottles, so not hot water bottles, but ones that are a bit warmer than your body temperature but not scalding hot. Don't put them on your tummy. make sure they're on your back. And also, if you feel like it, try cold things. So you could have a cold pack with ice in at the base of your spine, that might help. It's really important that if you feel these pains are getting worse, you might need to see a physiotherapist if it's more muscular than it is kind of to do with your kidneys, like you've suggested. So make sure that you see your midwife again soon and ask her about where you go from here. Okay then, so the next lady wants to know whether low-level inductions, as she calls them, are successful. So when you're induced in your pregnancy, you start off by having a vaginal pessary. It depends on where you are as to whether you have one over a few hours or over 24 hours. This lady wants to know if they work effectively. Yes, they do. I can't give you a direct answer to your question whether it will mean you'll need a hormone drip, but I have had a lot of ladies that have gone into natural labours completely on their own with just the pessary alone, so don't worry too much about that. Obviously, you're being induced because your baby's small, so it's worth mentioning that, you know, afterwards, talk to your midwife about what you're going to expect with the care of your baby if there are complications. Not that I'm saying there will be, but I don't know if jumping in for an elective cesarean is necessarily the step you should take. It's a very personal decision, and induction, although it's successful, it's not always the nicest process, I'm not going to lie, but neither is having a cesarean. That's not a walk in the park. You can have a lot of pain afterwards. So if you have a doctor, like an obstetrician, have a talk to them about your choices and see what they recommend that's best for you. Okay, so the next question asks me about the term of viability, and it's something that a medical person has with a medical hat on. Don't let it fool you that there's a problem or they feel that your pregnancy isn't important. It's just that in life, obviously, there has to be a cutoff, and we class 24 weeks in the UK as the viability point. So viability is when the pregnancy and the baby would have a chance of survival outside the womb. So then before that point, we class that as non-viable because we wouldn't feel it could. It's just something that we have to mention. Talking about where you say you shouldn't bother doctors or midwives with anything up until the 20-week scan, please don't feel like that. We want to know when you're concerned and we want to help you. Just let us answer, just ask the questions and let us help you. However, obviously, kind of certain questions can be asked a little bit later on once you've had all your scans and things. So don't worry about the question you've got to answer. She will answer it for you. But medically, with her hat on, that's what she means. And it's something that we say, but please don't take it to heart. It's nothing personal about your pregnancy. So the next question asks about a lady who's had a miscarriage. You say that you found out your rhesus negative and you had anti-D after your previous D&C procedure. So you don't need one at this point in your pregnancy. You only need an anti-D injection at around about 28 weeks with this pregnancy, unless you have any bumps to your tummy in the meantime. So if you get any bleeding or any bumps to your tummy, make sure you go and see someone. But the routine process is an injection at 28 weeks and certain areas of the UK at 32 weeks as well. So ask at your GP surgery. You don't need to have one in advance of any issues. They will only give them if an issue has occurred, because you have a 3-day window from that point to give it, which will still be safe. So that is all your questions answered. It was brilliant getting to see what you all wanted to know that you never asked. And you know what, we had a fabulous spread. So there was great questions, really important questions actually, that perhaps people don't consider when they've not had the time in face-to-face with their midwife. So well done, everyone. If this is something you would like us to do again, then please make sure you let us know in the original thread with the questions and we can sort that out for you. So don't forget to subscribe to the Mumsnet YouTube channel and keep an eye on the forums in the pregnancy section for future videos, because we do post them from time to time.